today we're taking coffee and coverage on the road, and we're going to UND Center for Family Medicine. Let's go! Hello and welcome back to Coffee and Coverage. Today we are excited to be back on the road where we're meeting with Kate here at the UND Center for Family Medicine Pharmacy in Minot. Thanks for having us today, Kate.
Thank you.
All right, we're going to get started. So first of all, why don't you tell me a little bit about yourself?
Sure. My name is Kate Klein, and I got my doctorates from North Dakota State University in Fargo. And I've been practicing here for about 20 years. And what we do here, we work alongside our residents and physicians to kind of help guide them with medications, dosage questions. They are coming straight out of medical school. So we're kind of there for education to kind of help them out.
Okay, very good. Do you work a lot with Medicare clients? So 65 and older.
I would say about 80% of our patients are Medicare patients. So yes, we do work a lot with Medicare patients.
What do you recommend your clients do first when they join Medicare?
First thing we tell them is it is overwhelming for sure, because there are so many different parts to it, Part A, B, D, E, supplements. So it's a good idea to contact somebody, like your office, and speak to somebody who's really knowledgeable in kind of getting them on the right track. And then, of course, finding a pharmacy that can help them as well, because every year it changes, especially when it comes to the drug portion. And new companies come on, old companies drop off, and the rates are always changing. So it's always a good idea every year to evaluate that and find the best plan for them.
Yes, exactly. What happens when you get a request for a medication that isn't on the plan's formulary? So we were talking about Plan D and the drug plans, and like you said, they change every year. So what happens if it changed, or let's say they added a prescription, and now what if it's not on their formulary plan?
And this happens often, very often. And I would say that this is kind of the bane of some of our residents' existence, is when there's formulary changes and the pharmacies are constantly saying, hey, we need to change this. We contact the doctor right away. And for us here, it's so easy because sometimes we could just run across the way and they're over in their offices and we can contact them. But, we do contact them, try to find the similar drug that's in that class, so we can kind of stay, very close to what the doctor already ordered, but then to find one with better coverage so we can save the patient money and still give them the best care.
Okay. So a lot of times, let's just say, there is maybe a workaround for that prescription.
Absolutely, there is.
There's a way to at least try.
There sure is, yes.
Perfect.
Yep.
What would you recommend to a client who is on Medicare and says they can't afford their medication? What happens then?
So a lot of times, if a patient is having problems affording it, they can go directly through the company. So medications, like, I'll give an example, like something like Eliquis, which is a blood thinner. We find that the nurses actually can assist the patient, get them signed up. There are some income requirements. And so sometimes the patient does have to submit some extra, forms and things like that to show where they fall in that income, category. But there's awesome help directly through the manufacturer. And then what they do is they mail the patient like 3-month supplies of some of those medications after they've received a doctor's order. But there's help out there. And sometimes even there would be coverage where they fall into certain incomes, so their copays and things would be lower based off of that as well. How do you handle medications that need prior approvals? So this is another one that can be a little sticky, because it depends on how fast the doctor can get to it. If some of their nurses are doing it, sometimes it's a little faster just because the doctors are doing a lot of other things, but diagnosis codes, so coding it correctly, gets these prior authorizations through faster. And so normally how our system works, which is actually how almost all pharmacy systems work, is when something is run through and it needs a prior authorization, it will be it's automatically generated and sends a message directly back to the provider and says, hey, here's a fax, this needs a prior authorization. And then we do tell our patients it can be anywhere from a week to a month, depending on that insurance company and how fast, the doctor can get that done. So,
Okay. With the increased popularity of GLP-1 medications, what advice would you give to those on Medicare when it comes to getting on those medications?
So this is a little tricky because GLPs are so popular now, and almost all the insurance companies want a diagnosis code. So normally if they are diabetic, it's so easy to get these approved. The insurance companies don't have any issues with that. They will approve that, it'll go through. And they are actually pretty affordable. Most of them, once the Medicare does approve it, they'll be around $47 or under, which is really nice. And that's after they do have to reach an out-of-pocket amount first. And normally that's going to be, this year, I think it was around $400. But, after that's reached, it's pretty affordable. But if they are, trying to find one for weight loss, then obviously the GLPs are a little harder to get. But there are other indications, and there's usually workarounds, I guess, that the physicians know about, because if there's multiple diagnosis, it's easier to get an approval for the GLPs.
Okay. What are some ways those on Medicare can save money on their medications?
Kind of what we talked about before, where they're getting it reevaluated every single year, because not only are their medications changing, but the companies are coming on that are maybe better or offer more coverage. So every single year, even though they're like, I love this one, it did a great job for me, they really should reevaluate, because the companies will send them stuff in the mail, but I'm going to be honest, I don't think a majority of the people read the stuff that comes to the mail from the insurance companies.
Well, they get bombarded, I think, and then they're not sure if it's real or not. Like they get nervous about that. So.
Absolutely. And so, checking every single year. And we do have a group of patients that will come in, and they have kind of just little lists that for the pharmacy staff, it's pretty easy to just put it in the computer and check it. We have, referred a lot of our patients to, Moran's at Pinnacle Group and places that if they've gone before, just to say, hey, let them take a look at it, see if there's a supplement or something else that can maybe help you. But
and I know, I'm sorry to cut you off. Sorry. Okay. Some of the companies offer like coupons too, right? Like, isn't there some medications that you can log on and get a coupon, or is that not necessarily through?
So the tricky part with that is Medicare. Once they're Medicare age, they can't use any copay cards and any coupons.
Okay. So then that doesn't go on the plan.
Correct. Okay. All commercial plans do, but none of the Medicare plans do. And so we usually say, 90-day supplies. If the doctor can write for that, that's going to save them money in like dispensing fees every month. So that'll save them some money. And then, choosing, obviously, if there's a generic formulation of the drug, they're going to want to get that. And then other than that, I mean, if they're trying to, find ways to save money, there are a lot of companies that do offer mail order. And I do know that those are becoming a little more popular. However, when you get a little older, there's a lot of med changes. So when they go see their physician, doses can change, meds can change. And it's not always a good idea to get that 90-day supply, because then the insurance will say, hey, we just sent you that 90-day supply. You're going to have to wait this out or pay cash. So, sometimes mail order isn't the best, but obviously that is a way to save money if you're going to be maintained on that drug and it's going to be a long-term thing.
Okay. Yeah. Very interesting.
Yeah.
Okay. Is there anything else you'd like our audience to know about Medicare and their prescriptions?
Yeah, absolutely. So number one, it's extremely important to not only find a good pharmacy, because pharmacies are kind of that gateway to not only saving money, but offering, some of the best care to the patient, because the doctor's office, they'll send the prescriptions to the pharmacy. The pharmacy is the one who catches duplicates. We'll catch, allergies. We try to reach out to the doctor and say, oh, you know what? This is, this many day supply. We're going to try to get, a 90-day to save you money for the next time. But, a good pharmacy will, we know our patients by name, and we, do a lot of, reaching out to physicians and their offices and trying to find, the best,
like truly
best
care for them, like care for them, have their best interests at heart, things of that nature.
Yes, absolutely.
Okay. So if people watching this want to contact you guys for further questions, how should they do that?
So we do not have an email address or anything, or, we don't really do anything online yet. So normally they got to do the old school thing and call us.
Okay.
Yep. So,
Or
they
maybe
can call us
stop in?
directly or stop in.
Okay.
Absolutely. And we do a lot of medication. So if they want to bring in, medications in a bag, which we've actually had this happen quite often. So they'll bring them in a big Ziploc bag and we just go through stuff with them and make sure there's no duplicates. And we even will bubble pack and do single dosing for people that just can't seem to remember if they took their meds. So we do bubble pack and special packs. So then,
that's nice.
It increases compliance and then they know if they've taken it or not. So we do that too. So, and we also have a disposal area so patients can bring in meds that they're not using. So they don't have them sitting around.
Sure. Okay.
And they can, dispose of them safely and not have them sitting out there for confusion or for others that might come over and have access. So,
okay.
Yeah.
Well, very good.
Yes.
Well, thank you, Kate, so much for joining me today.
Yes, absolutely.
And taking the time to answer all of these questions. If you or someone has questions about this or our Medicare topics, feel free to give our Medicare specialist a call at 701-858-0058. Also, stay tuned for information coming soon on our next On the Road episode. Until then, thanks for watching. And remember that coffee is optional, but coverage is not. Thank you.